Overdoses in one city in southeastern Ontario skyrocketed yesterday afternoon, prompting police to issue a public warning advising against unnecessary travel into the downtown core. Tamara Ugolini here with Rebel News, and as advocacy groups continue down this purported path of harm reduction, the concept of safer supply, we can see that harm continues to skyrocket and safety continues to be compromised. That came to a head yesterday in the small city of Belleville. It has a population of roughly 55,000 residents and is along the 401 corridor in southeastern Ontario, where there were 14 overdoses in just 1 hour in the middle of the afternoon. According to local media in Quinte, Belleville police issued a no-go warning on Tuesday afternoon after emergency officials responded to initially 13 overdose incidents in the middle of the afternoon from 3:30 to 4:30 p.m., which ended up being a total of 14 overdose incidents. Fortunately, they say no deaths were reported. Yes, this happened in broad daylight, again, in the middle of the afternoon, in case people were wondering just how safe supply and harm reduction efforts are going in this country. This is being referred to as an overdose emergency and has prompted city officials and community agencies to meet later today to discuss this crisis. This will include members of Belleville Police Services, Belleville Fire Department, Quinte, which is the larger municipality where Belleville is, Emergency Management Services, and the Health Unit. Belleville Mayor Neil Ellis says it's hard to get the message out about drug toxicity to the homeless population that it's affecting and blames this on lack of services like housing and rehabilitation from the province.
We tried to get the message out, but it's hard to get that message out to the homeless or to the non-house people that this is affecting. And it goes back to services, and when you look at the services which the province supplies, mental health, nurse practitioners, we just don't have enough of that for rehabilitation, and the proper gold standard is housing first and wraparound services, like I mentioned, and that doesn't solve it totally, but that's the greatest success to house first.
A week ago, there were 5 overdoses in Belleville between the hours of 5 p.m. and 9 p.m. In Ontario as a whole, there were 1,324 opioid and stimulant-related deaths for the first half of 2023 from January to June. This is up from the 867 deaths that we had in 2016. That's a year before the Canadian Drugs and Substance Strategy, acronymed CDSS, came into effect, a number that nearly doubled to 1,265 thereafter. You see, the Liberal government implemented this federal program in 2017, and it was supposed to reduce the harm of substance use on families, individuals, and their communities.
Safe consumption sites. There was one when we came into office in 2015. Now there are dozens and dozens and dozens across the country, and they are saving lives significantly.
But at its 5-year update in 2022, the program was unable to yield any sort of tangible results, and instead, data shows that it resulted in increases in overdose deaths and harmful drug abuse.
We are pretty fed up with this fight against evidence-based programs that actually are saving lives. We cannot allow the Conservatives to take us back to the failed ideology of the past. Even Harper's advisor, Ben Perrin, thinks they're speaking nonsense. So just stop it and save lives.
What we've done around harm reduction and safe consumption, the project that we have, working with BC to decriminalize possession of harder drugs now. There was a lot of shouting about that, and it's a very politically polarizing issue still. I mean, you can see the Conservative leader doing videos about how bad that is, but grounding ourselves in facts and data and public treatment and evidence of a public health problem is the way to move forward on this. So we're going to continue.
And because hundreds of millions of dollars of the federal budget were allocated to not being able to garner any tangible results, the final report's key takeaways noted that the rates of substance use and related harms only continue to rise. So what do the Liberals do? They issued a December 2023 update noting that they would continue funding this program with over $1 billion allocated to its failed strategy since its inception. This idea of safer, publicly funded chemical drugs regulated through the government is obviously failing to keep anyone, including the communities affected by illicit drug use, safe. It's also clearly failed at reducing harm. For Rebel News, I'm Tamara Ugolini. It seems like wherever harm reduction and safer supply advocates go, chaos and decay follow. That's why we've launched a petition and website dedicated to covering this crisis of open-air drug use and the out-of-control crime and poverty that inevitably ensue at fixourcities.com. At that website, you can support our journalism if you would like. You can also sign our petition and sign up to receive updates on these kinds of reports. That's all at fixourcities.com.